Good afternoon, ladies and gentlemen. I'm Harry. You all know me. This is third in a series of educational videos and Skypes to help you and your franchisees make money. Today we're going to discuss dentistry, the types of dentistry, the types of dentists that do that type of dentistry, their specialties, their educational requirements, and the correct terminology to use for that doctor. All dentists attend a regular college to learn prerequisites, and they attend dental school usually for a duration of 4 years. After their 4 years of dental school, they graduate and they take a board. They take a national board and they take a state board. They must pass these boards before they are allowed to practice. If they fail their boards, they get a chance to retake the boards in 90 days. They also have a chance to go through their entire education again and take the boards again remedially. That ensures that the public has a good quality of dentistry. Dentists, like medical doctors, police themselves through organizations such as the American Dental Association, otherwise known as the ADA, the FDA, the Florida Dental Association, various state organizations. There are a board of examiners that are chosen usually among senior dentists and usually among the instructors at dental schools that set this criteria for the young graduates. These also are the governing bodies for malfeasance or malpractice in dentistry. A dentist does less than substandard work. If he has a drug addiction problem, if he has an alcohol problem, and it shows up in his practice and in the quality of his patient care, he is quickly governed and it is adjudicated by a board of his peers, and corrective action is taken, usually fining or loss of license, loss of privileges. First, I would like to discuss a general dentist with you. General dentists are referred to in two ways. You will see DDS and you will see DMD. There is no difference in the educational qualification for the titles. It's just a title. You can actually almost guess where a dentist went to dental school by DMD or DDS. DMD means Doctor of Medical Dentistry. DDS means Doctor of Dental Surgery. They're both the same things. A general dentist is just what the name implies. He does general dentistry. A general dentist is taught in school. He's taught orthodontics, basic orthodontics, which is braces. We will get into this later. He's taught periodontics, which is soft tissue or gingival or gum care. He's taught the basics of these. He's taught the basics of endodontics or root canals. He's taught the basics of prosthodontics, which is dealing with removables, dentures, removable prosthetics, dentures, crowns, and bridges. They specialize in the aesthetic aspects of dentistry. Any dentist can do these, any general dentist, but to advertise or to add the orthodontic title onto the back of your name, the general dentist must go to post-grad education to be a full-time endodontist, to specialize in that, a full-time orthodontist, a full-time periodontist, or a full-time prosthodontist. To advertise that as a shingle, he must have post-grad education. General dentists are the dentists that we as a group are most used to seeing. General dentist is your standard dental office, a couple of operatories, up to 5 or 6 operatories depending on the size of the practice, a hygienist or two, assistants, front desk people, fiduciary people that actually run the business for him and deal with insurance. A general dentist's duties can include fillings, restorations, crown and bridge, minor gum surgery, extractions, any kind of aesthetic or cosmetic concerns, toothache, also hygiene. The general dentist sees the patient more often than any of the other specialists, about every 6 months. That's when hygiene recall is. The hygienist is a very, very much a vital practice of a general dentist's practice, is a vital, vital, vital part of a general dentistry practice. The hygienist is actually the one that usually sees the patient every 6 months, and the dentist comes in and does an examination. General dentists are very good at what they do. They're very good at establishing patient bases. In some instances, you guys will run into third-generation general dentists that have been in the same practice from grandfather all the way to grandson. Very loyal patient following. General dentists are somewhat limited as to what they can do legally and safely. A general dentist will rarely extract a tooth because, number one, extraction is frowned upon these days. Restoration of the tooth is most important instead of extraction. A general dentist will go out of his way not to extract a tooth. But they will do an extraction if it's not complicated or surgical. A general dentist can also do root canals or endodontics if they choose to. If they choose to do that. A general dentist can do prosthodontics. A general dentist can fit dentures and crowns and bridges if that's his strong spot. General dentistry means they can do everything, but they stop when the case gets difficult. Many general dentists will not see children. They will refer a child to a pedodontist or a pediatric dentist, of which we will get into at the end of our discussion today. If a general dentist sees a tooth that needs to be extracted, but it's a posterior tooth, let's say a third molar. Most of us have had experiences with our third molars or either our children's third molars being taken out, and usually around high school graduation, between high school graduation and college. You'll see very few general dentists doing that. It's a complicated extraction. The tooth could break during the extraction and the root tips would have to be retrieved from the jaw, and that's 9 times out of 10 what happens. So that turns into a surgical extraction where the gum is actually cut and sutured. The general dentist doesn't want to take the legalese and the legal problems that can ensue for that. Nor a general dentist likes to see a patient an hour. There's no way you can do that in an hour. The patient that needs that tough extraction may be immunocompromised. There may be a set of problems with them. The general dentist is not set up in his office to handle resuscitation and extreme emergencies, which is why he refers such matters to an oral surgeon. An oral surgeon is a dentist with a dental degree as well as a medical degree. Oral surgeons specialize in facial trauma, in car wrecks, sports injuries, extremely tough surgical extractions, broken mandibles, broken jaws. Oral surgeons are usually on the staff of a hospital, which means that they can be called in at any time to handle an emergency case from an auto wreck or something. Oral surgeons differ slightly in the equipment that they use from a general dentist. Oral surgeons use surgical drills, not handpieces. You guys know how hung up I am on names. They use surgical drills called Stryker's or Hall drills. They're actually made in the medical profession to cut bone, any kind of bone cutting. Essentially, it's a bone saw or a bone drill. And they're powered by nitrogen or electricity instead of compressed air. Very rarely will you see compressed air in an oral surgeon's office. Everything's going to be nitrogen driven from a tank or either electrically driven. The chairs that an oral surgeon will use one of two things. He will either use a gurney, which is a stretcher like an operating table, or he will either use a dental chair that has IV boards. Instead of the standard armrests, you have IV boards that you can actually lash the patient's arm down to the IV boards and sedate them. An oral surgeon can sedate a patient. He can give you twilight sedation. He can knock you cold. He can give you several different kinds of sedation. Any kind of anesthesia he can administer, either intravenously, orally, any way. You are usually twilight sedated or knocked out for the procedure. Oral surgeons also have recovery rooms, small recovery rooms like a hospital where they roll you to recover and see how you're going to come off the anesthetic. Oral surgeons refer most complicated extractions to the hospital to do at the hospital instead of in their facility, because the hospital has better resuscitation equipment and better crash carts and better sedation than they can offer in the office. Although a lot of oral surgeons have a very complete pharmacopoeia in their office and their offices are state of the art, oral surgeons have to understand medical to dental relationships. They understand the arteries, the carotid artery, how it affects healing. Oral surgeons are actually trained well enough in their panoramic radiographs to look, and they can actually see plaque, if they know how to read that x-ray right, forming in your carotid arteries and in your jugular veins. When you're forming plaque there, it's just a matter until it washes to your heart or into your brain and causes a stroke. Oral surgeons are very valuable. They tend to be a little temperamental, but they've got a good 12 years invested in their education, dental and medical school, and they deserve the respect that you give them, very much so. Oral surgeons can be a source for a lot of business for us, because oral surgeons all use panoramic x-rays. Every oral surgeon without fail has a panoramic x-ray. He needs that panoramic x-ray to see the apical or the root structures of the third molars before he extracts them. You've got to have a pan. And that patient is always referred to the oral surgeon from the general dentist. Sometimes the general dentist sends a pan with the patient. Sometimes the oral surgeon makes his own pan on top of that pan. An x-ray is only good when there's infection or things going on. A radiograph is only going to be good for a week or so before the morphology and the topology of the mouth changes. So it's very important. Most of your business with oral surgeons is going to be with radiographics or either the chairs working, or their lights, or most oral surgeons use a track light, a ceiling-mounted track light, be it a Peltman Crane, a Mid-Mark. Most oral surgeons use a track light. Okay. But as far as handpieces and delivery systems, they don't use a lot of handpieces and delivery systems. Oral surgeons do, however, use vacuum pumps, ladies and gentlemen. And when they have no suction, they cannot work. So emergency to an oral surgeon is a true emergency to us, because they may have a patient compromised in the middle of the treatment. when that vacuum goes down, and you must act Johnny on the spot with an oral surgeon. Okay? Now, another referral from a general dentist is to a periodontist. Periodontists deal with gingival issues, gum issues. The biggest part of our periodontists nowadays, the biggest population, are hygienists that have actually went back to dental school and then went to perio residency. They make the best periodontists. Hygiene is an extremely vital part of a perio practice, even more so than a general dental practice. Because instead of going like you would go to a general dentist every 6 months, you would go to your periodontist every 3 months so they can get the gingivitis and the perio disease under control. Periodontists also do gingival contouring. In layman's terms, if you have too much gum covering your teeth, which is known as hyperplasia, they trim that gum back so you can actually see the enamel of your teeth. They graft gum, they graft gingival tissue, and they graft bone. Most general dentists will refer that patient out if they have perio disease, meaning mobility of the teeth. If you can actually wiggle the teeth in the sockets, they go to the periodontist. The periodontist specializes in immobilizing those teeth. Periodontics are big business now. Periodontists market aggressively to their niche in the market. Implantology, implants is all you hear these days. A lot of general dentists place those implants. Most of your implants are going to be placed now by periodontists. Because after an implant's placed, it has to have periodontal maintenance, meaning it's got to be flossed in the whole 9 yards or it will reject. Nobody understands the osseous to soft tissue relationship and is trained better than a periodontist. Also, now we're educated and we have a correlation between cardiovascular disease, heart disease, and perio infections. That's where periodontics come in even more important now. Nothing improves your general health better than periodontal health, even better than your dental health. Your periodontal health affects your vascular system in so many ways. It is a very important specialty, and it is a very growing specialty. Periodontists use handpieces. Periodontists like electric handpieces. They like air-driven handpieces. They use standard operatory equipment, standard chair and unit, standard suction. Some use cuspidors, some don't. They use the Dickens out of Cavitrons. Periodontists do a procedure called an SRP, which means scaling and root planing, and osseous surgery, where they actually have to cut your gingiva. It's called laying a flap. They pull your gingiva back in a flap. They take that scaler and they plane that bone root smooth so the gingival or gum tissue will bond back to it and grow back to it without any voids or pockets. Very important. Periodontists are also a good place to sell instruments, ladies and gentlemen. They will be some of your best instrument customers, without a doubt. Okay? Now, none of these dentists or specialists that are being referred to from the general dentist retain those as a patient. The patient always is the general dentist patient. The periodontist will always refer the patient back to the general dentist for any aesthetic work, crowns, bridges, whatsoever. The oral surgeon will always send that patient back to the general dentist for a crown. Let's say they had a broken jaw, fractured mandible, or had to do an anterior surgical extraction. Protocol dictates and politeness dictates that they send that patient back to their general dentist for that work. That's the way the referral chain works. They are very interdependent of each other. And the doctors, the specialists, court the general dentists, so the general dentist will refer their patients to them. Very interdependent, very, very, very interdependent, ladies and gentlemen. One can't work without the other. Our next specialty is prosthodontics. Prosthodontics come from prosthetics. We can make an analogy. A fake eye, glass eye, that's a prosthetic eye. Fake leg, a wooden leg, that's a prosthetic leg. A crown in your mouth, that's a prosthesis. A denture in your mouth, that's a prosthesis. A bridge, a partial, that's a prosthesis. Anything that God didn't put there that man made to substitute for God's work is a prosthesis. Now, we have two types of prostheses: removable or fixed. Permanent or removable. A fixed prosthesis would be a crown or a bridge that is glued down to a stump or a prepared tooth. A removable prosthesis would be dentures like your grandmama or your grandpapa remove and put in a jar next to the bed, or a partial that they can take out. Anything removable is called a removable prosthesis. Okay? You won't hear them say that. You'll hear the doctor say, I do a lot of removables. And that's just, I do a lot of removable prosthesis. That's just a fancy way of saying I do a lot of dentures for people. Okay? Now, a general dentist is quite, let's harp on dentures. Since our population is aging, more and more people are in need of dentures. That general dentist, some general dentists love to do dentures, some won't touch them. Dentures are a gift. Either you've got them or you don't. I don't care how many boards you've passed, you can either do a denture or you can't, or you don't want to mess with it. Because usually it's elderly people that get dentures and they're long-winded and they don't have anybody to talk to, and they're hard to satisfy. The general dentist will actually refer that patient to the prosthodontist to make the denture, because the prosthodontist has an innate understanding of the denture and how it fits in the patient's mouth. A prosthodontist is very, 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 very detail oriented. I guarantee you, any prosthodontist office you go into, there will not be one piece of dust in the corner. The chairs will be armor-alled. They will look wonderful. The staff will be standing tall and knowledgeable. Because why? Prosthodontists are aesthetic-minded and appearance-minded. The reason that patient comes to that prosthodontist is not to improve their chewing, not to improve their health, to improve their appearance. Now, let's go back to the interdependency thing again. The prosthodontist may have one tooth left in his way before he can do a good restoration. The prosthodontist isn't going to extract that tooth. He probably hadn't extracted a tooth since dental school. He is going to call the general dentist and say, who do you want me to refer this guy to for the extraction, Dr. Smith? Do you want to do the extraction, or do you want me to refer him to the oral surgeon? Either way. See the interdependency now? Okay. Prosthodontics are a money-making thing. Okay? Let me do stress now. We're having hard economic times. General dentists are choosing to keep more in-house, meaning they're not referring as much. They're trying to keep more of the procedures in the house, just to keep the money in the house, in the office. But they're not above referring out if it gets too tough for them. They have to weigh the litigation that could come if the procedure fails or if something happens to the patient against the money they're going to make on the procedure. It's a continual balancing act for them. But more and more you'll see them keeping them in-house. You'll see them doing their own root canals and so forth up to a certain point. Okay. Now our next one we're going to talk about is an orthodontist. I'm sure we have all heard of the braces, the orthodontist. If we don't have teenagers that we've had to send for orthodontic, catastrophically expensive orthodontic treatment. We all know the old orthodontic syndrome. Let me regress for a second. Let me digress. Periodontists, prosthodontists are also going to use standard chairs, units, and lights. They usually like a really high-end handpiece. A prosthodontist is nobody to sell a low-end handpiece to, because they want to cut a quick crown prep, and they also use their handpieces for polishing, aesthetics, and everything. But they use general dental equipment, air compressors, vacuum pumps, lights. Some of them use nitrous, some don't. Okay? And they usually have an on-house lab, but usually a fairly elaborate in-house lab. Okay? Now let's get back to orthodontics. Orthodontists manually and mechanically straighten teeth. It's as simple as that. Some general dentists are doing orthodontics if it's not too complicated. Usually they refer to an orthodontist. In an orthodontist office, like a pedodontic dentist's office, is usually somewhat young people and kid-oriented. It has video games in it, and it's kind of styled hip-hoppy or whatever the latest thing is. They usually court that, and they court young people. And they're good at handling adolescents. They understand in orthodontic school, they go through psychology courses to understand adolescent minds and so forth, how to handle them, behavioral difficulties, and the whole 9 yards. Orthodontics is a large moneymaker. You'll usually see orthodontic offices, they don't have private rooms, they have open bay concept, meaning they have several chairs laid out in a straight line or either in a crescent around a central sink, where everybody can hear everybody else, everything that's going on, and the staff can communicate against each other and with each other. An orthodontist takes an impression, makes a model, and takes a panoramic and a cephalometric x-ray. From that cephalometric x-ray, which is a profile shot of a patient, as you all know, and it shows the teeth whether they're orthognathic, which means buck teeth, protruding, or if they're orthognathic, which means an invite. They can straighten that. They use a series of gradients and geometrical measurements to determine that. And they do the consult with mom and daddy and sell the case. And usually the orthodontist places the brackets on the teeth, bonds the brackets to the teeth, and places the wire. After that, usually his staff does everything, and he checks the staff's work. Most orthodontists only have one high-speed handpiece. Orthodontists do nothing bloody or nothing invasive, which leads back to the interdependency and referral thing. That orthodontist, you have a supernumerary tooth, which means the child has one more tooth than it needs. The orthodontist wants that tooth extracted so it crowds the other dentition less, and he can straighten the arch out. That orthodontist ain't pulled a tooth since taking his boards. He calls a general dentist. Hey, Dr. Jones, who do you want to do this extraction? Well, send him to Dr. Smith, the oral surgeon. See how it works? Everybody stays in touch with everybody. Now, during orthodontic treatment, which can last up to 3 years depending on the orthodontic malady and the mechanical adjustments that need to be made, the orthodontist is sending his patient back to the general dentist for cavities, care,